Hello, welcome to MBBS course. I know you're all fresh from school and you may find it difficult to orient yourself into the system which is currently in vogue. In school, you will be used to be handheld every corner of your journey. But here in MBBS, you will be guided but not handheld. You will be given a map asking you to follow the directions provided in the map. So you should learn to travel on your own with the help of the map provided by your teacher. So now I'm going to guide you on how exactly to get used to the MBBS curriculum and also how you're going to get accustomed to the newer learning process. Now, before dwelling a bit into the study aspect of first year MBBS subjects, I would like you to understand that there are three important subjects, the main subjects, which you should cover in the first year. And they are anatomy, which happens to be a study of the structure of the human body. Then comes physiology, which is a study of how exactly the body functions. And third comes the biochemistry, which studies the chemical processes that occurs inside the human body. So these three subjects are your first year subjects. And initially, you will find it very difficult to get oriented to the terminologies commonly used in these subjects, particularly in anatomy, where majority of the terminology will be either in Greek or in Latin. You need at least students, according to me, need at least 2 to 3 months for them to get accustomed to these terminologies. Initially, you should not lose heart when you hear the teachers using terms which you've never heard in your life. So you give it some time. Slowly, you will get used to it. I wish to state at this juncture that the human brain has two memory slots. One memory slot is for short term memory, the other memory slot is going to be held for longer duration. What you should aim is to hold all the subjects in medicine you have learned in the to be held in the long term memory slot. It is human brain is more or less akin to a computer. Whenever you open a word processor and start typing, the initial letters you type will be stored in the RAM. Supposing if there is a power outage, then if you reboot the computer, what happens is you would have lost the letters you have typed. Similarly, when you sit inside the classroom, initially you'll be so enthused, you'll feel so happy that you have understood what all your teachers have said. But the problem is these will be inside your short term memory. The art of learning medicine is pushing all these stuff into your long term memory slot. That happens only by constant practice, constant learning, constant thinking. Only that will lead you to push all the stuff you have learned from the short term memory slots into your long term memory areas of your brain. Why you should hold your subject in the inside the long term memory area is because this is where this is only subject where you carry your knowledge till your breathe the last. You're going to use it on a day-to-day basis. Without this knowledge, you're not going to succeed in the field of medicine. So you have only one chance to learn and use that chance prudently and start learning properly. And now the next thing you should know is how to choose the right textbooks. So many of you would have been bombarded with a list of textbooks which are easy to use. Some of your seniors will say pick up a smaller textbook so that you may need to read little bit. So I will personally advise you to use standard textbook because your learning process is not going to stop. It is going to be a perpetual one, and moreover For you to get a postgraduate seat, a coveted postgraduate seat after you complete MBBS, you need to be very strong in all the subjects which is covered in the MBBS curriculum. For that to happen, you need to stick on as much as possible to standard textbooks. So let me just enumerate some of the standard textbooks which, according to me, will help you in your process of learning. In anatomy, I consider Gray's Anatomy still to be the Bible of the subject. And I will advise every one of you to use Gray's Anatomy from the beginning so that you will be you will have a good grasp of the subject. Then comes Indian author Chaurasia, which deals with regional anatomy. So what happens is, if you want to read upper limb alone or lower limb alone, if you want to read abdomen alone, so region by region you can read. You can learn the subject if you use Chaurasia. But personally, I will like you to start learning the subject using Gray's Anatomy, but use Chaurasia for your long exam time rapid revision. I repeat again, I will like you to start reading from Gray's Anatomy, which happens to be in the Bible of anatomy, and then resort to turning the pages of Chaurasia during your exam preparation. Then anatomy is all about diagrams. The moment you see a diagram, you take some time seeing the diagram so that ultimately the same diagram gets imprinted into your brain. So diagrammatic learning of anatomy is very important. And there's a fantastic textbook called Atlas of Human Anatomy by Netta. So I want every one of you to buy this book and keep it open while you read Gray's Anatomy. You keep the anatomy atlas also open so that you will be able to get a three-dimensional view the entire subject. Then physiology. Physiology, again, standard textbook happens to be Guyton. I want every one of you to learn Guyton, because if you know your physiology well, your learning of medicine becomes that much easier. I repeat again, if you know your physiology well, if you spend a lot of time uh, focusing on the learning process of physiology, learning medicine in your final year becomes that much simpler and easier. Then a few other textbooks like A.K. Jain or Sembalingam, I leave it to your choice. But personally, I want you all to read Guyton. Guyton is a very good textbook, and some of you may have laid your hands on Ganong. Ganong is also an equally good book. So I will prefer you to either read from Guyton or Ganong and use Sembalingam for exam revision purpose. Biochemistry, I will like every one of you start reading from Harper. Harper is a wonderful book which gives you a detailed description of biochemical processes that take place inside your body. So you need to focus on certain important topics. Your teachers will be giving you a list of important topics. At least those topics you spend time reading from Harper. And then you can revise, do a rapid revision during your prior to your exam using Vasudevan. That is a good book for revision purpose. But to learn the concept, to learn it properly, you need to learn from Harper. Now, for anyone who studies medicine, should plan his study. Without a study plan, you are not going to go anywhere. So you should devise a study plan. Study plan should suit you. Should be tailoring. It should be tailored to your convenience. So I mean, my plan may not be suitable for you, and your plan may not be suitable for me. So I will prefer you to just use this as a what I call sketch plan, and then fine tune it to your convenience. So every day, every one of you should have fixed study slots. Your study slot should be fixed. So morning, don't miss out on morning hours, because morning hours you are really fresh and your hormone levels will be peak in the morning hours. That too early in the morning. So don't miss out that 1 hour morning study. Every day 1 hour, say between 6 or 7 or 5 or 6. Have a habit of getting up early. Go to bed early. Get up early. And use that 5 to 6 a.m. slot to study. So that start when you study during that early morning slot, what is there in your recent memory invariably gets pushed to a what do you call, the very good memory slot, that is what you call perpetual memory, which is going to stick on with you forever. And then during your class hours, take notes. Make the art of taking notes, make your writing point by point, so that it's easy for you to recollect when you go to a room or home. So you cultivate the habit of taking very, very short notes, succinct notes while your teacher is addressing you. Every evening, you spend 2 to 3 hours studying. That too, I will prefer you to have a fixed uh, time for your study hours before your dinner, ideally before your dinner. And here is the time when you should focus reading from standard textbooks. And after dinner, before you go to bed, at least spend 15 minutes to 30 minutes trying to recollect what all you have studied during the day. That really helps you to push the short term memory into your stuff inside the short term memory into your long term memory. So your retention will be more if you spend at least 15 to 30 minutes recapping what all you have studied during the day. And during the weekends, don't waste them. During your weekends, it is a time to revise the entire week study. At least think about what all happened during the entire week. So that is an important aspect which you should not forget. I don't say that you should be with your book always. You take your time enjoying your life, but don't miss out don't spend the entire weekend enjoying. Allot some time to study, introspect, and revise the entire week's program. And every one of you should focus on active learning. How exactly you will actively learn? It can be done only by drawing diagrams, and that too, drawing flowcharts. So you need to cultivate a habit of what all you have learned. You should put it on a paper. Best way is to put it as a flowchart. And medicine is one subject where learning through flowcharts helps you a long way. Then combined study is a real beautiful thing, which helps you to push your things stuffed into the recent memory into the long-term memory slots. So discuss among your friends, combine with like-minded 3 or 4 friends, start studying. Then try to teach somebody. If a friend wants to learn through listening, catch hold of him or her, make him or her sit there next to you, start teaching them the things you have learned. So when you learn and then when you start to teach, it gets really imprinted into your mind. And then when you're reading these 3 subjects, I would like every one of you to integrate those 3 subjects. Supposing when you're reading cardiovascular anatomy of the cardiovascular system from Gray's Anatomy, just go to your physiology textbook of cardiovascular, open up the cardiovascular system, simultaneously read the physiological aspects of cardiovascular system. This helps you to connect the dots. So naturally, our syllabus and timetable should be designed in such a way that in the same day the anatomy and physiology classes should cover the same organ system. But what happens is invariably it doesn't this integration does not happen due to so many reasons. So at least in your study hours, try your maximum to integrate these subjects. These are subjects which can be integrated, should be learned in an integrated manner. As I have already told you, when you're reading a system, supposing you're reading gastrointestinal system anatomy, just go open up your physiology textbook, simultaneously start reading the physiology of the gastrointestinal system. What happens is you get a 360-degree orientation of the subject. Then dissection hall is a place where you really learn anatomy. So never waste even 1 hour of the dissection hall posting. You need to go to the dissection hall, spend time there. You have a dissection manual called Cunningham manual. Use the Cunningham manual. see those structures which is being displayed, keep looking at it for long hours so that the entire structures will get imprinted into your mind. Don't just have a look as if you go for exhibition, just go look at the what you call the exhibit and get away. That doesn't work here. You need to stand by the specimen, touch it, feel it, lift those structures, see them, and then try to get a imprinted picture of the uh, dissected specimen imprinted into your mind. That is how you learn anatomy. And then you will be studying bone. Study of bone is known as osteology. So I expect every one of you to pool money and buy bone set. Two people can combine together buy one set of bone. And some of you who are smart enough can borrow from your seniors who have already bought a bone set. So without a bone set, you won't be able to read osteology properly. So you need to have a bone set. Then you need to mark the muscle insertion and origin in the bone. And you should also try to articulate the bones, two or three bones, you try to articulate and learn about the joints. So, osteology, you should have a bone set with you. You can't learn from images. Osteology should be learned from bones, physically touching the bone. Then only you'll be able to do justice. Then only the structures of the bone, the various angles, various ridges, various grooves will get imprinted into your mind. So please, please, please buy a bone set. Without bone set, you're not going to go anywhere. If supposing you feel that the bone set is going to be expensive, at least go to the anatomy department, take a bone set. Whenever you get time, go there, take the bone, open the textbook, sit there, start reading every bit of every line you read. Look at the bone in your hand and see whether you are able to connect it, understand it properly. So osteology is learnt only from physically keeping the bone in your hand, not otherwise. Then you need to use physiology lab. One thing is, never skip, never take leave, never skip your dissection posting or your lab posting, because they teach you a lot in your lab and section floor. So in physiology, you need to learn the experiments properly. And during biochemistry, you should understand the logic behind each test and not the steps alone. I repeat again, when you are in the biochemistry practical hall, just don't memorize the steps. Just get into what exactly is the logic behind each step. So they would have written down 3 or 4 steps for you to perform in biochemistry. But you should think that what is the logic behind each of these steps. So there is always a logical way of learning. So in biochemistry, unless and until you follow the logical way of learning, you are not going to go anywhere. Now, I need not uh, stress the importance of revision. Unless and until you revise regularly, unless and until you revise complex topics frequently, they are not going to be pushed into your long-term memory area. For example, for exam preparations, you should use flashcards. Flashcards is a very good way of preparing for examination. Always prepare your exam using the short notes you have written. You have taken from the class, or you have written notes from your textbook. Make use of these notes you have taken and read from them exhaustively. Then I want everybody to be smart in taking notes. So when you are attending a class, you should know that when your teacher is addressing a topic, you should be smart enough to note the points illustrated or told by your teacher as sentences, small, small sentences. And then when they join dots and correlate something, some concept clinically, you spend time highlighting those correlations so that when you go home or go to your room, you can use the physiology textbook along with the anatomy textbook to learn in an integrated manner. And then when you write notes, always leave some space for future write notings or updates, so that when you complete a topic, leave a page, one page gap, so that when you go to another textbook, some extra points you will come across. You can always make it note it down in the space available. So always leave space uh, for adding future updates. Next is, commonly I find nearly 20 to 30% of you are stressed by the curriculum and the learning process. So you should always minimize the stress. You should, living here in this era is stressful, but how are you going to reduce the stress? This can be done by take regular breaks. So between your study hours, take a break of 5 to 10 minutes. Talk to your friends. Create lasting friendships, because your colleagues and friends are going to travel with you for a long time. I want everybody to go to bed early, have at least a 6 hours sleep, then only morning will be fresh. And never compare your speed of learning with others. Only thing which matters in medicine is you need to be consistent. Your effort should be consistent. And this is a marathon, it is not a sprint. So instead of resorting to intense preparation, you need to be consistent in your preparation. So switch your intense preparation concept into consistent preparation. And then last but not the least is, I want every one of you to develop doctor's mindset. And you need to do it rather early. Most important aspect of a doctor's mindset is you should always ask why. You should always ask why. You should understand the mechanism, and don't treat everything as a fact. Always go into the basics. Always go into the mechanical mechanism, how it occurs and why it occurs, instead of taking it as a factual value. And always observe patients during your hospital posting, and start thinking clinically. Start thinking clinically. Start organizing your thoughts even during your first year. Now, without a study plan, you're not going to go anywhere. So I would like everybody to have a study plan. So I'm going to give you a 3 month sample study plan. So you just have a look into it. Then you tweak the given study plan to ensure that it suits your way of study. The first month, you need to build the basics. First month, you need to build the basics. So, for example, in your first 14 days, you all underwent a foundation course program. This foundation course is actually tailored and meant to build the basics for you. Now, let's come to the first month lesson plan for anatomy. During the first month, you focus on upper limb and general anatomy first. So that is what it will be covered in the first month of posting. So focus on upper limb and general anatomy. Then learn the bones. I told you, you can't learn osteology without holding the bone in your hand. For heaven's sake, buy a set of bones as early as possible to learn the bones, muscles, joints, and nerve supply. The first month, these things should be done. And spend time in the dissection hall and observe structures practically, each and every structure. Ideally, what I would like you to do is you have a look at the Cunningham model the previous night. You all know what you're going to dissect tomorrow. The previous day, you just open your Cunningham model, at least previous night, before you go to bed, and read up what you're going to do the next day. So, brush up of Cunningham manual before then entry into the next day into the dissection hall will give you a better understanding. Then I will love everybody to draw simple diagrams and label them properly. So It is not, I mean, you need not draw Mona Lisa. Just a line diagram will do. The diagram should indicate the appropriate shape of the organ and the notches and ridges. It's enough if it's approximate, but you need to label them properly. The beauty is you need to label your diagram properly and correctly. Next comes the physiology. First topic which you always start is the cell membrane. They will be spending at least a week on cell membrane and transport inside the cell and then blood circulation. And the basic concepts of homeostasis and feedback mechanisms will be covered in the first month. So, the concept of homeostasis and feedback will be covered in the first month. Then you need to understand red blood corpuscles, white blood corpuscles, and blood coagulation process. So, these things you need to complete in the first month of preparation. Then biochemistry, you need to begin with the cell structure. You need to study the biomolecules, carbohydrates, proteins, and lipids. These things will be covered in the first couple of months. Then you need to learn about amino acids, enzymes, and their properties. And then you always should focus on the structure and functional relationships when you are studying biochemistry. Now, second month is what we call the month of deepening understanding. So this is where what all you read during the first month, you need to introspect and deepen the understanding of the subject. So anatomy, again, during the second month, you study the lower limb and thorax areas. You focus on nerves, vessels, upper anatomy, where they will teach you what are the things that go wrong in a disease called foot drop. And then while during the second month, see, even though you are covering lower limb and thorax, don't forget to revise your upper limb anatomy at least once a week, because anatomy is one subject which will vanish into thin air from your brain. So unless and until you repeatedly revise, you are not going to push the recent memory things in the recent memory slot into a long-term memory slot. Physiology, you cover the nerve, muscle physiology, cardiovascular system, and respiratory system. Then you need to know about the normal graphs, normal values, and which you get during your performance of experiments in your lab sessions. Biochemistry, you study protein, metabolism, lipid metabolism, genetics, nutrition. Then this is where, in this phase, you will learn a lot about trying to correlate the biochemical values with the clinical condition. You need to focus on revising the practical exams, writing answers with diagrams, use short notes for quick recall. Thank you. I hope this lecture served its purpose.